So, when you have bariatric surgery, you have to learn to deal with whatever happens to be bothering you rather than turning to food. And this is one reason why a lot of people gain weight and is one of the major psychological components related to obesity. Because again, like I say, you may not be aware until much further on down the road that your eating is related to psychological reasons. Okay, what happens is after you have the surgery, you're immediately forced to deal with the issues. What happens for a lot of people is that after they have the surgery and their weight starts to go down, emotional issues will creep up. And that's when you learn whether or not your eating was related to emotional issues. If they are, you may turn to something else to deal with the stress of those. So switching addictions is very often an unconscious process. It's not really something you go, okay, I'm not going to eat, so I guess I'll drink. It just kind of happens. Ultimately, what you have to do so that you don't switch addictions to something else is to learn to live life on life's terms. A lot of the people that I see for these pre-surgical evaluations have had some difficult things in their childhoods. Now, most of us have, so that's not a big deal. The idea is to address those, find out maybe what's underlying some of the problems and why you're turning back to food or to another substance. One of the things that I want to mention is that a lot of people tell me if I could only understand why I'm doing what I'm doing, then I could quit. Well, I'm kind of an insight junkie. I like to know why I'm doing the things I'm doing, but sometimes it doesn't really matter. Let me give you an example. Sometimes people say, well, if I only knew why I was driving through the drive-thru, then maybe I could stop. In other words, they're looking for one specific reason why they're doing something. First of all, I will guarantee you there's not one particular reason, and if you could find that one particular reason, like, I don't know, my mother always took me to the drive-thru, that would change that behavior. Although it's kind of good to learn what's underneath some of your behaviors, you don't have to understand the why to change the behavior. In other words, you cannot drive through that drive-thru without knowing why you're there in the first place. So what I want you to understand is that behavior change can be done whether or not you have the insight behind it. People tell me all the time, I'm trying. Trying is dying, okay? You either do something or you don't. That's not to say that, you have to expect perfection out of yourself. It is to say that if you're having particular trouble with an issue, find out why you're having trouble with that and learn what you can do to get over the difficult times. Okay. Another thing patients tell me all the time is that they hate to exercise. Well, a lot of people do. And so what I do is I ask them a series of questions. For example, I'll say, how badly do you really want to get up 5 mornings a week and go to work? How badly every morning and every night do you want to get that toothbrush out and brush your teeth? How badly do you want to stop in the middle of the day when you're running errands to put gas in your car? Probably not very badly on any of those. It's not an issue of whether you want to or you like to or you hate to. It's a matter of, what do you want more? Do you want to lose the weight more or do you want to not exercise? So it's, not what you don't want, but what you're going to do anyway. Remember when I asked you, what are you willing to do to get this weight off and to keep it off? So many times people tell me anything, I'm willing to do anything, I just want to get this weight off. Exercise is part of that anything, all right? Some people tell me, because I say exercise is a choice, you have to choose to do it. They say to me, well, I don't choose to go to work, I don't want to go to work. And I say to them, really, you do choose to go to work. You may not think of it that way, but what you want is you want the paycheck. You want the ability to spend your money in the way you want to spend it. Go on vacation, buy new clothes, buy a car, whatever you want. The same is true with exercise. If you don't choose to do the exercise, you don't get to have the benefits of it. So again, you may not want to, but if you choose to, it'll work. One of the things they say at the Harvard conference about exercise is that in order to prevent weight gain, you need to have 60 minutes of exercise a day. And in order to keep weight off, you have to have 60 to 90 minutes of exercise a day. I know that doesn't sound fun, and I'm not the one who came up with those numbers, but you're going to have to make the choice. What do you want more? Do you want to have sustained weight loss and better health, or do you want to complain about exercising? I want to talk a little bit about the difference between exercise and activity. I had a woman recently tell me, well, I get a lot of exercise at work. I'm up and down, and here I go to the hall and I go to make copies, and exercise and activity are two very different things. And you're going to need to have increased amounts of both following surgery. Activity is good. You want to do things like park farther away from the store, which a lot of people are starting to do. Take the stairs when you have the option. Those are activities. Exercise means keeping your heart rate up for a sustained period of time. So don't make the mistake and think you get exercise at work. You have to get on a treadmill or go swimming. Make it something fun. Make it something that you want to do. Okay, one of the things to do to develop good habits and to change your thinking is to develop healthy mantras. In other words, develop some automatic thoughts related to things. For example, you know what? I may not want to exercise, but I tell myself it's what I do. Personally, I work very long hours, and at 9 or 10 at night, I'm not always thinking how excited I am about getting on a treadmill. But automatically I think it's what I do. So then I do that. You're going to have to establish these mantras and implement them in other areas as well. For example, I don't like to take the time to plan meals, but it's what I do. I don't like to walk out of the break room when there's all kinds of goodies in there, but it's what I do. I've always heard, if you want to be a virtuous person, then you do what virtuous people do. If you want to be an educated person, you do what educated people do. The same is true for thin. If you want to be a thin person, then you do what thin people do. Imagine my surprise when I came across a book, after I say this to people year after year. There's a book called The Beck Diet Solution by Judith Beck, and I highly encourage you to get this book. The subtitle of this book is Train Your Brain to Think Like a Thin Person. She makes great points in this book about the ways that thin people think. One of the things that Dr. Beck says about how thin people think is that they learn to eat to the point of being reasonably full. They don't have to be terribly full or miserable. They learn to eat to the point of being reasonably full, and they say to themselves, and they think, I'm glad I ate to the point of being reasonably full. I feel better that way, and ultimately I'm going to look better. Okay, my health is going to be better. Also, thin people learn to eat when they're hungry. They don't eat because of being bored or being highly emotional. They don't always eat to celebrate. They eat when they're hungry. They learn also to withstand hunger. A lot of people who are heavy or obese tend to think of hunger as an emergency. I've got to eat. Oh my God, I'm hungry. I've got to eat. But you've got to learn to tolerate a little bit of hunger. In this country where food is very plentiful, you are not going to starve to death, okay? You've got to learn to accept that being hungry is okay because you've planned your food and you know you're going to eat in another hour, so you can say to yourself, it's what I do. I eat on my schedule, I've planned my food, I'm going to work my plan. Also, thin people restrict what they eat. Believe it or not, thin people don't just eat whatever they want all the time whenever they want. Now maybe there's a few people out there like that, we don't like them, we won't talk to them. But most of the time, people who are thin restrict what they eat. They don't take every dessert just because they want it. They limit their choices and they limit their portions. They accept the reality of those limitations. This is going to be hugely important for you as you learn to live like a thin person. You have to accept the limits and accept the responsibility of living within those limits.